The defense rested their case today in the murder trial of Lindsay Clancy, and the Commonwealth of Massachusetts called rebuttal witnesses back. The lawyer representing the native of Wallingford, Lindsay Clancy, continues to say the mom of three killed her children because she was experiencing postpartum psychosis. As you can imagine, this case has ignited a much larger conversation about postpartum mental health. NBC Connecticut's Taylor Regan takes a closer look.
Lindsay Clancy has bad days and worse days.
As the Lindsay Clancy murder trial continues, jurors have heard testimony from several key witnesses, including one of the doctors who treated Clancy following the deaths of her children.
People with psychoses have intermittent symptoms. They can function fine one day, and the next day they can be hearing voices.
But what is postpartum psychosis? According to the Cleveland Clinic, it's defined as a rare and severe psychiatric emergency that occurs after childbirth.
Part of the reason we consider it a psychiatric emergency because there's a drastic change in the maternal mood, behavior, and thought process.
And it impacts more women than you think. Research suggests an estimated 1 to 2 out of every 1,000 births. Symptoms include sudden mania, severe depression, hallucinations, delusions, and insomnia. But Dr. Ariadna Forray of the Yale School of Medicine says many doctors aren't trained to recognize it.
One of the things that's happening within the field of psychiatry is a discussion around we really need to define what this is to make it easier for clinicians that maybe are not experienced in treating what to look for and how to more easily diagnose it.
Another obstacle is a lack of consensus. Postpartum psychosis is not directly listed in the DSM, the main handbook used to identify mental health conditions, so more research needs to be done.
More education and training in our broad general psychiatry residencies, and there are some efforts across nationally to bring that along.
Postpartum psychosis is a treatable condition, but Dr. Forray says many women don't ask for help out of fear of judgment.
There's a lot of stigma about disclosing or talking about anything that has to do with our mental health. Having awareness and having these discussions is another important piece to this.
If you or someone you know is a new parent who's struggling or in emotional distress, you can call the National Maternal Mental Health Hotline, 833-852-6262. Taylor Regan, NBC Connecticut News.